So Prakash, uh, COVID has given a big fillip to retail sell, and what I gathered that Star Health Insurance is the biggest gainer. The way they have been doing the retail health insurance business, I find that it is 2827 crores, way ahead of 1898 crores last year. You have been doing wonderfully well. But the question that I'm likely to ask you, are you going to stabilize it? How are you going to stabilize it or sustain it in days to come? Retail health insurance, in fact, was not growing. It was the other businesses that were growing, and that was something we were looking at. And looking at the retail business that your company has managed and other players have also managed, that is really heartwarming. My question, I repeat, are you going to sustain it from here, or how are you going to sustain it?
Thanks, Dr. Abhijit. Thanks for the compliments. Star Health Insurance, we are able to grow because of the scale and reach that we have achieved over a period of last 14 years. And we give importance to some fundamental strategies that are not just priorities for now, but it has to be used for all time. And I should point out to 3 or 4 major reasons where we think we have grown and where we think we can remain sustainable. Number 1 is I should thank the regulator for the reforms that they have brought in. The reforms that they have brought in, particularly during the pandemic, with regard to allowing us to innovate new products, short-term products, disease-specific products, giving some specific allowance for people who are admitted with COVID-19. All these things could help us to promote health insurance as a concept in tier 3, tier 4 areas also, and take their penetration forward. That's the reason why we are able to grow from our average growth of 28 to 30% since last year to close to around 47% so far this year.
Right, sir.
So the most important thing is, we have to continue to innovate products, and this innovation and the futures of the product and the cost of the product should fit the expectation of the people, particularly people in the underrepresented areas. Insurance is yet to penetrate into a lot of areas. We have less than 14% of people who have either retail insurance or group insurance. So naturally, the outer potential for market is very high. So the need for insurers, if they have to sustain, to come up with innovation in their products and innovation in their distributive methods. The second thing is, which is very important in this context, particularly during COVID-19, there are a lot of uncertainties. Doctors and hospitals are also not clear about the treatment protocol. There are a lot of myths and facts we are discussing even at the end of 10 months. Whatever we thought to be helping in the treatment of COVID-19, majority of them have been disproved. Like, some of the drugs or the need for the ventilators or so many things, what we had as an apprehension in our mind. Now, the reality shows totally different picture. So what I'm trying to say, in this context where there are a lot of uncertainties, and Dr. Abhijit was telling that, are you happy in growing? And can you sustain this growth? I am growing today. As a company, we are growing, but with a fear, because our claims outgo is much more than our growth. For the month of August and September, the increase in claims outgo is much more than the growth that we were proud about. Meaning that to address these things, if I am paying for the treatment cost of my policyholders, I'm okay, I'm happy, because insurance, I'm a risk bearer. I should be willing to pay. But the problem is most of the time we pay for either the anxiety or for the extra cost of the hospitals. This requires some amount of synergy between the payers and the providers, between the hospitals and the insurance. And I think this synergy and standardization of cost and bringing in standard operating procedures, if not for all conditions, let us start with COVID-19. Because with regard to COVID-19, There are categories by which we can grade the patients as mild, moderate, or severe. And there are fixed treatment protocols which are approved in the West. And most of them have been successful, and it has been implemented in most of the hospitals, and state health authorities have also accepted these protocols. If these protocols are followed strictly and our cost is made as per the protocol, then probably we can help the policyholders have a hassle-free service. And in this, particularly during this crisis, if insurance can give an hassle-free service, that can promote a lot of confidence in the minds of people and clear away all the trust deficit in the minds of people against hospitals or doctors or insurance, because the whole healthcare ecosystem should flourish. And there is a lot of opportunities in the near future for this ecosystem, all stakeholders in the ecosystem. So I think, the most important things what I want to summarize is continuing innovation and attractive products with appropriate pricing so that it fits the buckets of all the people of all economic strata should come forward and take insurance. And insurers, under the blessings of the regulator, should achieve a synergy with the hospitals with regard to pricing and standard operating procedures. And the continuing reforms created by the regulator should really, continue as they have been motivating us. It should continue to motivate the insurers and help us grow more and more.
Dr. Prakash, evidence-based therapeutic interventions which leverage software to prevent, manage, or treat a medical condition in lieu of conventional treatments based on pharmaceuticals is likely to be the order of the day. Don't you think that Indian health insurance industry should look at the health outcomes? It's only they are looking at reimbursement of expenses, with not really looking at the health outcomes. Don't you think that the industry should seriously start looking at evidence-based medicines, evidence-based treatment, evidence-based protocols?
Thank you so much. That's a very pertinent question in this context. Because, insurers, currently we are paying for the activity. In future, should it be activity related or performance related? Clinical outcome related. If you want to pay as per the clinical outcome is better only if they practice evidence-based medicine. But today in India, when we were medical students, we saw clinical medicine where a diagnosis is made based on the clinical examination, history taking, and the doctor spending time with the patient physically. But today, clinical medicine has graduated into investigative medicine. No specialist can reach a consensus without an investigation or subjecting the patient to a higher test, which all involves cost. So clinical medicine has graduated to investigative medicine, and insurers are looking at evidence-based treatment, the strength of evidence-based treatment practiced by the hospitals, so that this, fortunately, Mr. Ramesh is also there. He is also very passionate about introducing major reforms. I can tell you only one thing, due to, like you said, there's a shortage of time. I can tell you one thing. Insurers today are bound to pay as per the contract, but they not only pay for they not only reimburse the cost of treatment, it is also their duty to authenticate and verify whether proper treatment is being done. All necessary measures are taken to arrive at a diagnosis, and the hospital has the expertise and infrastructure to offer that appropriate treatment. So a patient who has got an insurance, today in India, where there are thousands of hospitals and there are differential practices, not all of them follow the same ethics, and there is no regulator for hospital, although the healthcare expenses around 7 to 8 lakhs. 7 to 8 lakhs per annum is healthcare expenses. Unfortunately, there is no regulator for hospitals. So with the differential practices that are available, I can proudly say that a person who has got insured, he is not only getting money for his healthcare expenses, his treatment and the line of management are being verified by an insurer there. So from this verification, once we start monitoring the outcome and clinical governance, for which we require registry. If I want to introduce clinical governance, I take some knee replacement or angioplasty as two examples. I need to create a registry. So a lot of things have to be done in future. And I am very confident that your very excellent question, whether insurance companies are going to pay only for activity, tomorrow definitely they are going to look at clinical outcome. And we are in the path towards it, and we want the government's vision also to be placed on this.
Dr. Prakash, don't you think that we need an institutional like NICE that is there in UK to look at the clinical appropriateness of every treatment that is undertaken by the health providers? Don't you think the time has come for such
Certainly,
kind
sir.
of
Certainly, sir.
institutions?
We have the
Clinical
opportunity.
appropriateness is something which everybody is looking at, because that is something which is going to bring down the cost also and make people happy also. The health outcome will be more pronounced in such scenario. And NICE has been doing a wonderful job in the UK market.
I had the opportunity to study both from India and from UK,
Okay,
and
that's great.
I'm very passionate, and it is very much required for our common people to have those guidelines, whatever is adapted and successful in the Western world, to be followed. As an insurer, we have tried to bring in issues like air ambulances or bariatric surgeries, or you're talking about rehabilitation. Now there are a lot of pain management, pain clinics. Mental health, regulator has recently included mental health, and regulator also wants us to come forward and cover dental health, treatment for infertility, for transplant. So many innovations are happening, and we are coming forward to cover such things. When we come forward to cover all these modern advancements and innovations, definitely we will look into the outcome.
Thank you.
Because
Thank
we are
you.
going to pay huge money. We will look into the outcome, and days are not far where insurers are going to give importance to evidence-based medicine, and they're going to pay for performance and not just for activity.
Absolutely. Thank you so much, Dr.